I'm Gabby Karatka, an 8th semester nursing student, and today I will be demonstrating how to change a sterile dressing on a central line IV. First thing I've done is gathered my equipment on this table. So I'm going to go ahead and enter my room, perform hand hygiene. Good morning, Ms. Smith. I'm Gabby, I'm your nurse. Today the doctor has decided that we need to change out your sterile dressing for your central line. It looks like it got dirty over the night. So if you can give me your name and date of birth, verify that, or you can go ahead and begin. The first thing I'm going to have my patient do is apply a mask over their nose and their mouth and turn their head away from the central line side, because we want to make sure that this is a sterile procedure and they don't cough or breathe over the opened sterile field. I also have a mask on, so I will keep that on for the procedure. We're going to apply some clean gloves here and take off the old dressing. When I take off the old dressing, I want to make sure that I don't create any skin tears or hurt the patient. So we're going to do this by gently pulling up the sides and away from the skin. And we can dispose of that old dressing in our trash. The next thing I'll go ahead and do is assess my patient's skin, making sure that there's no signs of infection. If there are signs of infection, redness, swelling, any pus coming out from that area, we will then go ahead and take a sample of it and send it up to the lab for a culture. We can also measure the external portion of the catheter that is showing, making sure that's appropriate. And I'm going to assess the 2 suture sites, making sure those are still intact, which it looks like they are. So next we can go ahead and remove my clean gloves, hand hygiene, and open up my dressing kit. Now that my dressing kit is open, I can go ahead and apply my sterile gloves. I'm going to apply my dominant hand first. And now that my dominant hand is in, I'm going to grasp the cuff underneath of my non-dominant hand. And now I can fix my gloves since both my hands are sterile. And now we're going to get into our kit. I'm going to set off to the side anything that's not necessary. Because my patient already has a mask on, I don't need to have them put on another mask. We're going to place my sterile field down. Dispose of anything I don't need. And get out my central line tegaderm. Okay, so we're going to pop this open. And when we scrub, we want to scrub for 30 seconds, 2 to 4 inches around the central line, making sure to cover all areas of the skin in all directions. And once I've scrubbed for 30 seconds, I can go ahead and dispose of that. And I can let it dry, and making sure that we don't cover it while it's still wet. We want it to be completely dry before we apply the new dressing. So while I wait, I could make sure that I uncover my new catheter, my new tegaderm. And now that it's been about 30 seconds, I can go ahead and apply my new dressing. So we're going to go around the dressing site. Making sure that I keep the actual window where the IV catheter is, the central line. And the lumens are going to go down here. And once it's secured all the way around, the last thing we'll do is take our date and time, fill that out and initial it, place that on a visible area of the dressing, but still make sure to not cover the window or the lumens to access that. And then lastly, I'll clean up, take off my sterile gloves, perform hand hygiene, making sure that I address any concerns my patient has. Maybe they need to be repositioned, maybe go to the bathroom. If they have pain, anything, address those things before I leave the room. And once I've addressed those, I can leave the room and document the type of dressing I used, how the patient tolerated it, and if they had any concerns, and making sure that if there was any changes noted, such as that infection or skin changes, I would document that as well.